We decided quite a few years ago now, after a lot of sort of requests from the clinical teams at the PH centres and from patients and their sort of kinship, to produce some material around contraception and the whole issue about pregnancy, which has changed over the last sort of 20 years. In the video, we're using one of the senior nurse specialists from the Royal Brompton in London, Carl Harris, who's got a lot of experience with over sort of 15, nearly 20 years now of PH and how things have changed, how we manage it differently, and having those conversations there. So it's very sort of factual but honest experience in that one. And then Dr. Helen Stockdale, who's GP, who's been working with us on this project from a more day-to-day practical experience point of view. And Helen is the person who's done the majority of the text for the book that really complements this video.
I mean, emergency contraception is one of these things that's changed massively over the years. These days the medication is different, you're less likely to be sick at all with it, and it's very easily available. You can even get it online. You can certainly get it from pharmacists, but there's, GP surgeries are often open later hours these days, or there's walk-in centres. There's really lots of places you could go to get emergency contraception. I know that sometimes people have, and there's been discussions about this in the medical community as well as with everyday folk, about, is emergency contraception actually a termination? Is it a way of aborting a pregnancy? And I think lots of debate has been done and looking into this, and I think this very strong feel is that actually emergency contraception is about stopping a pregnancy happening. It's not about getting rid of a pregnancy, and it's really quite different. I think the other thing that's worth saying about emergency contraception is about time frame. The quicker you get it, the more effective it's going to be. So again, don't feel embarrassed. Don't apologise for being in the situation that you're in. If you think you're at risk of getting pregnant, do something about it. The sooner the better. You do have anywhere between 72 and 120 hours, depending on what type of emergency contraception you use, but the sooner you take it, the better. I think it's also worth saying with people with pulmonary hypertension, although there's lots of ways you can get the emergency contraception, and certainly try those methods if you're stuck, there might be some hesitancy of prescribing that perhaps online or through the chemist, just because, if you do happen to be on other medication that they're not very familiar with. But certainly talk to your chemists, because they'll still be able to point you in the right direction, even if they don't feel confident in giving you the emergency contraception. And finally, the really important thing about emergency contraception, it's not a continuous form of contraception. If you found yourself at risk of pregnancy, use this as an opportunity to think about long-term contraception, something that will really protect you thoroughly and properly and over the long term. I think certainly it's really clear with pulmonary hypertension that the odds of an uneventful, safe pregnancy are slim. So this is why medically we would suggest that the right course of action would be to terminate the pregnancy. And for some people that's really hard, and I think anybody working within the PH community knows how hard that can be for people, and certainly would be there supporting you all the way along.